Okay, so now we're going to talk a little bit about centrifuging. Does centrifuging improve the aspirate or the treating composition? And so some things I think are false assumptions. Everything that I aspirate is marrow. We know that's not true. You might be aspirating all blood, depending on your technique of aspiration. Stem cells are captured in the buffy coat. That's not true. The density of stem cells goes from, let's say, 1.03 to 1.08. And nucleated red cells go from, let's say, 1.05 to 1.09. There's a big overlap between where my stem cells are, and they're not captured in that buffy coat, which tends to go from a density cells of 1.03 to 1.05. And you say, well, why are those stem cells so deep in the red cell layer? Well, think of a stem cell that's a progenitor cell and it's cycling. Right before it divides, it looks like it has two nucleuses. Two nucleuses, it's a very dense cell. When I centrifuge it, it's not in the buffy coat, it's in the red cell layer. And we're going to see that in a minute. So they're not captured in the buffy coat layer. Marrow cells are uniformly dispersed. We know that when we do the aspirate, we just showed that. Your best cells are along that inner bone lining. There's a different cell population in the center of the medullary space. So just because you're aspirating in that bone space doesn't mean you're getting a lot of the cells that you're looking for, because you may not be targeting the niche in the marrow space where those cells reside. This is one that people have called me out on. They say, centrifuging 8 ml to 2 ml, obviously there's going to be more cells in the 2 ml than the 8 ml. And people say, you say that's not true. And I should say, no, I don't say that's not true. If you take 8 ml, centrifuge to 2 ml, you're going to have more cells in the 2 ml than the 8 ml. You take 60 ml, centrifuge it down to 8 ml, you'll have more in the 8 ml than the 60 ml. What I say is, if you want 2 ml, don't draw 8 and centrifuge it down to 2. Just draw 2. You'll have more in the 2 that you aspirate than you will than if you take 8 and centrifuge it to 2. And I think that's true even with our product. And I showed you that when I compared 1 ml with our product to 1 ml with a regular needle. So there's a difference there. I'm saying aspirate just the volume you need, target the niche along the inner bone surface, and you'll have more cells than any other protocol that you can follow. So here's a paper. This was done by HSS. What's interesting, you can see the CFU count in the aspirate. This was done by Dr. Lane, and his technique was he pushes the needle forward, aspirates, put the stylet back in, pushes the needle forward, aspirates. And he does that, and he draws 30 cc's. He does 2 sticks for a total of 60, and then he centrifuges it. And notice a couple of things here. This is the CFUFs per ml, 1200. And in this particular centrifuge system, it was not as efficient recovery. Per ml was 514. And notice the percent recovery of stem cells. 56% and 39%. Where'd they go? If they're not in the buffy coat, where's the other 45%? Where's the other 60% of the stem cells? They're in the red cell layer. So you're throwing them out. You're not even capturing with your centrifuge protocol. There's another test. This first one was harvest arteriocyte. This second one is harvest biomet. But the biomet's instructions for use, same needle, same everything, isn't to aspirate, go forward, aspirate, go forward. It's put the needle in and draw, and then maybe rotate and pull back. Notice the difference in the aspirate. Same needle, same open-ended trocar. But technique matters even with a traditional needle. The stem cell count, hugely different. Big drop off in CFUs when I don't aspirate the right way by that forward technique. But notice this percent recovery again, 57 and 44%. They're in the red cell layer. Every now and then you'll see a paper like this or a white paper like this. And I want people to be careful so that now we know that we want to look at, what's the percent recovery? How efficient was this centrifuge process? So in this case, we're saying I took 60 ml that had 1,000 CFUs in it, and I centrifuged it down to 12 ml, And there were 12,000 CFUFs in the 12 ml. Well, if I take 60 ml times the 1,030, that gives me a total population of 61,800 CFUs. If I take my 12 ml times the 12,073, that gives me 144,000 CFUs. If I take 144 divided by 61, that gives me a 234% recovery. So I didn't lose cells in my centrifugation process. They doubled and tripled as a result of the centrifugation process. Based on this literature and this literature, you lose a big significant part of those cells in the red cell layer when you centrifuge, because the density of the progenitor cells that have two nucleuses are in that red cell layer. And when I look at the work at HSS, these are my percent recoveries. But somehow, here, I have a 234% recovery. That's nonsense. When you see people put that in front of you, you just look at it and go, say nothing. Just, put it aside and move on, because it's either sampling error, who knows what it is. But it's almost embarrassing you would put it out there. This is another example of that. The same thing. I have 55 times 192, or 55 times 200. Those look right. That's about what I would have in my total available. That can't be right. You didn't do the sampling right. So it's no information. So you see stuff like this, it doesn't tell you good or bad, just there's no information. This same protocol was done by a different doctor who understood how to count, and you can't get over 100% recovery. And lo and behold, got something consistent with the previously published literature. And if you go to the lab will say, no, I counted that correctly. The lab did count it correctly, I'm sure. But you didn't do the sampling correct. They only counted what you sent them. And if you don't do the sampling correct, you get a garbage result. So I point that out because you see some of that out there, and you should just, roll your eyes and just move on. It's not serious work. So in my experience, centrifugation protocols, you have a low stem cell content, you have high TNC. The nucleated cells from peripheral blood have the same density as nucleated cells from marrow. So I'm doing a density separation. I'm going to have a lot of nucleated cells, not necessarily a lot of stem cells. The percent recovery is always going to be between 30 and 60%. If you think you're getting more than that, then you're not, because that defies the biology of the material working with. And that, by the way, when you get those percent recoveries, the hematocrit is around a native level. If you try and eliminate the hematocrit, your percent recovery is going to be about 3, 5, 10%. And just like those cardiac papers where when I eliminated the red cells, I got no difference between treatment and control. You can't get rid of the red cells. People who say I do pure BMC, I roll my eyes, I go, how can you do that? You do this invasive procedure to go into the bone, then you do a centrifugation protocol to throw away everything and wind up with plasma from bone marrow. It's just wrong. I feel bad for the patient. And if you have over 100% recovery, it's just a sampling error. Disregard that work. End of this section. Nick, what do we got?
Please, if you can take anything home from this presentation, if you're looking at papers that show you over 100% recovery, please take a look at that. We've seen it on the Biologic Orthopedic Society for over a year now. Please comment. Please, it's something that's impossible.
Biologically impossible.
Biologically impossible. Andy, one question that we have here. It does not make sense to me that you could have more cells in a starting aspirate than the centrifuge product, even if your percent recovery is only 50%, because of your volume reduction is about 85%. So the tables from the HSS study showed more cells in the centrifuge product than the aspirate. Can you dive into that a little bit for us?
Yeah, so you're right. So here, that's per ml was 205, and then after centrifugation is 1014. So if I take 60 ml and I centrifuge it and I have a reasonable percent recovery, I'll have more in my centrifuge product than I will have in my aspirate. What I always say, though, if you do the aspirate correctly and you draw from the sides, you'll have more in the aspirate alone without any need to centrifuge. So that gets back to some people accuse me of saying that you don't get more after you centrifuge. You do, but what you're centrifuge is garbage. Had you just done the aspirate correctly, you don't need a centrifuge. That's what I say.
One more question from Dr. Tortland.
I think what gets confusing, and correct me if I'm wrong, Andy, is you can't have more total number of cells in your centrifuge sample than what you started with, but you have more cells per ml.
Correct. That's exactly correct.
That's an important distinction.
Right.
It's per ml, so you are concentrating them to a higher degree per ml, but the absolute number of cells that you end up with after centrifugation physically cannot be more than the absolute number of cells that you started with.
Right.
It's a concentration factor.
And exactly. And you see the centrifuge companies, they sell their products this way. They say, you know, I'm 3 times baseline, 300% over the baseline. Well, I can be 300% over my aspirate baseline if I take, I do a 90% volume reduction and I get a 50% recovery. That's about a 3x increase. That's a very inefficient centrifuge process, but because I've taken such a big volume to a small volume and only captured 50% of it. But in that same scenario, it should be, 3x should be 6x or 7x had I captured them all. So it's a game that people play with the math, but that's why I try to, walk through the math here